Hello and welcome. Today we're diving into a condition that affects the eardrum, myringitis. Specifically, we'll be focusing on two types, bullous and granular myringitis. This exploration aims to provide a clear understanding of this often painful ear condition, covering its causes, symptoms, diagnosis, and treatment options. Myringitis can arise from several factors. Bullous myringitis is often linked to bacterial infections, with common culprits being Streptococcus pneumonia, Haemophilus influenzae, and Moraxella catarrhalis. Viral infections can also trigger it. On the other hand, granular myringitis is typically associated with chronic inflammation and can be related to prolonged exposure to irritants or previous ear infections. Sometimes, the exact cause of granular myringitis remains unclear, classified as idiopathic. Let's delve into what's happening within the ear. In bullous myringitis, the infection leads to inflammation and the formation of fluid-filled blisters, or bullae, on the eardrum. These blisters are extremely sensitive, causing intense pain. Granular myringitis involves chronic inflammation of the eardrum, resulting in the development of small, granular projections on its surface. This chronic process can thicken the eardrum and potentially impair its function over time. Understanding how common myringitis is requires a bit of context. While precise figures are difficult to obtain, bullous myringitis often occurs in conjunction with, or as a complication of, acute otitis media, which is a common ear infection, especially in children. Granular myringitis, being more chronic, is less commonly diagnosed and its prevalence is less well documented. Anyone, regardless of age, can potentially develop either type of myringitis, although certain factors, like frequent ear infections or exposure to irritants, may increase the risk. The symptoms of myringitis can be quite distinctive. Bullous myringitis typically presents with sudden, severe ear pain. This pain may be accompanied by hearing loss and, in some cases, drainage from the ear, especially if a blister ruptures. Granular myringitis, on the other hand, may cause more gradual symptoms, including persistent ear discomfort, itching, and mild hearing loss. Patients might also describe a feeling of fullness or pressure in the ear. Diagnosing myringitis involves a thorough examination of the ear. Using an otoscope, a doctor can visualize the eardrum. In bullous myringitis, the presence of bullae is a key diagnostic sign. For granular myringitis, the doctor will look for the characteristic granular appearance of the eardrum. In some cases, a tympanometry test might be performed to assess eardrum mobility and middle ear function. Cultures of any drainage may also be taken to identify any underlying bacterial infections. While both bullous and granular myringitis affect the eardrum, they are classified based on their distinct characteristics. Bullous myringitis is defined by the presence of fluid-filled blisters on the eardrum. Granular myringitis is characterized by the appearance of small, grain-like projections and chronic inflammation. Recognizing these distinct features is crucial for accurate diagnosis and targeted treatment. Treatment for myringitis depends on the underlying cause and the severity of the symptoms. For bullous myringitis, antibiotics are often prescribed to combat bacterial infections. Pain relievers, such as ibuprofen or acetaminophen, can help manage the pain. In some cases, a doctor may carefully puncture a large bulla to relieve pressure and drain the fluid. The treatment of granular myringitis focuses on reducing inflammation. Topical steroids may be prescribed to apply directly to the eardrum. In cases where irritation is a contributing factor, avoiding exposure to irritants is crucial. Regular ear cleaning, as directed by a doctor, can also be beneficial. While completely preventing myringitis isn't always possible, several measures can reduce the risk. For bullous myringitis, prompt treatment of ear infections is essential. Practicing good hygiene, such as frequent hand washing, can help prevent the spread of infection. For granular myringitis, avoiding exposure to known ear irritants, such as smoke or excessive moisture, is important. If you're prone to ear problems, regular check-ups with an ear, nose, and throat specialist are advisable. The prognosis for myringitis is generally good with appropriate treatment. Bullous myringitis typically resolves within a week or two with antibiotics and pain management. Granular myringitis may take longer to resolve, and symptoms may recur. However, with consistent treatment and management, long-term complications are rare. Recent research has focused on improving diagnostic methods for identifying specific pathogens involved in bullous myringitis, leading to more targeted antibiotic therapy. There's also ongoing research exploring the potential role of anti-inflammatory agents in managing granular myringitis more effectively.